But choosing to bring a baby into this world is a huge decision. Then come all the other questions, starting with how a mom wants to deliver. There are so many options when it comes to a birth plan, and now the Holland Hospital is offering moms care through certified nurse midwives. Nicole is the director of the Boven Birth Center. Breck, a certified nurse midwife. Ladies, thanks so much for being here.
Yeah, thanks for having us.
Let's first talk about what a midwife does, kind of what the benefit of having a midwife would be when it comes to doing your birth plan.
Sure. So the big difference between a midwife and your typical OBGYN is really our approach to pregnancy and birth. We tend to approach it more as a normal life event and not a medical event, so you kind of see that in the way we care for women. And then the time that we spend with women is usually significantly different. Prenatal visits we purposefully schedule for much longer so that women feel that they really have the opportunity to sit, be heard, be well educated, and come up with goals for their birth so that we can kind of get in line for what they really want their birth to be like.
Absolutely.
And then during the birth, labor, all of that, we're very present. If a mom's there laboring, the midwife's there laboring right along with her, and we just find that a really important part of the whole experience.
Yeah, wonderful. So talk about why the Holland Hospital decided to bring midwives into the fold here.
Yeah. So for those of us who work in healthcare, we're always looking for ways to elevate the safety and the quality of the care that we provide, and meeting our community where they're at. And over and over and over, we were hearing, we want midwife services at Holland Hospital. So it became very important for us to bring that service to Holland Hospital. And Breck and her team, they're here now as of April 1st, and we're thrilled.
Wonderful, yeah. And you know, the birth center, very new. Let's talk about how, you know, the state-of-the-art technology and then bringing in these new services, how that's really going to help moms and families in their journey.
Yeah, so in 2018, we started a renovation and expansion of our birth center, completed it in 2020, so it's beautiful. Everything is new. And part of that renovation, we were able to add 2 ORs, so state-of-the-art operating rooms for those moms in the situations where maybe they need to have a C-section. Those operating rooms are right on our labor and delivery floor, adjacent to the labor and delivery rooms. We have the only level 2 special care nursery in the Lakeshore region, so very proud to have that as well. You know, we want everybody's birth story to be what they want it to be, but sometimes it goes down a little bit of a different path. Maybe baby decides to come early or needs a little extra help transitioning to the outside world. So that special care nursery is there and available for those babies. So we're very proud to offer that to our community as well. As of April 1st, in addition to the midwife services, we also started an OB hospitalist program. So we have 24/7 in-house OB physician coverage, which is wonderful for our patients. It offers just another level of safety for our pregnant moms. And then an OBED is possible because we have that physician coverage in-house, and so we started that also on April 1st. So lots of things, April 1. We're 1 month in, everything's going well. We love it, and anyways, and just super excited to have Breck and her team.
Yeah, that's wonderful. And you know, talk about, you know, for a mom deciding what her birth plan what she wants it to look like. Obviously, you know, it's malleable and it changes. But let's talk about how you guys can help a mom. You know, how a midwife can you know, give her advice, or you know, how to make sure that she knows what she wants and can understand. Because if you haven't had a baby, it's hard to know.
Something
exactly.
new.
Right?
So at Holland Hospital, midwives are caring for low-risk women. So that's kind of the base criteria. So they call our office. We kind of do a risk assessment. And if they qualify for midwifery care, they come see us. And then we get them plugged in with prenatal education, doula services, things like that, just to help guide them and develop that plan that we really try to meet their goals as much as we can.
Wonderful. And actually your care does go beyond the baby too, as regular, you know, female services go, right?
Most definitely.
Yeah.
So we care for women all through their childbearing years. We can do well woman care, contraceptive care, and then obviously pregnancy, birth, postpartum care, things like that. Yeah.
Well, welcome to the team. This is so exciting. Anything else that you want everybody to know about these services and why it's so important?
We are just so excited to be at Holland Hospital. I mean, what a beautiful place to be, both outside in Holland and inside the birth center. And it really just doesn't get any better than the care and all the services that Holland Holland Hospital does offer.
Wonderful. Well, thank you both so much
Yeah.
for being here. We appreciate it. So you want to learn more about the Boven Birth Center, about midwifery there, chooseboven.org. You can go to the website or you can give them a call, 616-748-5760. We'll be right back.